Dental insurance pisses me off, and I'm going to rant about it real quick. I just had to write up an appeal to a dental insurance stating that they were not going to cover or help cover the full mouth SRP that I did because there's no evidence of radiographic bone loss. First of all, let me just start by saying that there is slight bone loss evident on the radiographs. There's slight bone loss generalized. It's a mild case of periodontitis, but it's still periodontitis. Now, the pocket depths were generalized 4s, 5s, and localized 6mm pockets with severe bleeding everywhere. Now, I know calculus buildup doesn't account if somebody has periodontal disease or not, but there was heavy amounts of subgingival calculus and supra to the point where I couldn't chart recession because I couldn't see it. Until I clean it off, I'm not going to know. And in this case, I'm also not going to put her through a full mouth debridement when I know for a fact that it's periodontitis. It's not a 43-46, and it's not a prophy, because they're stating that there's no clinical attachment loss, there's no bone loss either, and so it shouldn't have been an SRP. You are not the one that was in the mouth cleaning the teeth. You're not the one that is actually physically looking at it. You can see like the images and stuff that we send you, and yes, I did have intraoral pictures as well, but you can't feel what we're feeling. They're saying that there was no way that I was doing a scaling and root planing on the roots because there was no attachment loss. Oh, be so for real. I was in those pockets, and even with the amount of buildup that was on the teeth, I was still able to get the probe up underneath to get a 6mm pocket, to get the 5s and 4s everywhere. Now, I can't show the intraoral pictures or her x-rays or anything because I didn't get consent. So unfortunately, I know a lot of y'all are wondering what it looks like. Just kind of take my word for it, I guess. But insurance, screw you, man. Like, you're not helping anyone when you're denying claims all the time. You're basically like going against what we're saying when we're the ones diagnosing it. Like, what the? And also, that makes the patient get pissed at the providers and the people that work at the dental office because they think we did it wrong when they're going to believe the insurance. Like, they're not the ones that are diagnosed. They're not in the office. They're literally insurance workers. Hello? So why are they deciding what needs to be done and what doesn't? I don't understand that. That makes zero sense to me. Now, I really hope this patient gets the coverage that she deserves from her insurance, and I hope this appeal helps, because that is a lot of money to have to pay out of pocket that she had no idea that was gonna happen to her. And I hate that. Insurance loves to deny, and it's frustrating because, like, why do we even pay for it if something's just gonna keep getting denied? And this is also why people think dentistry is a scam.